Surgical sponges, a surgical material. Look at this picture, shows that a definition. Surgical sponges are absorbent materials made primarily of cotton or gauze that are used to surgical setting to control bleeding, absorb fluids and aid in the surgical procedure. They are designed to minimize the risk of infection and promote healing. Types: 1. Gauze sponges, standard sponges made of woven cotton or polyester gauze, often used for absorbing fluids. 2. Lab sponges, larger sponges used for absorbing large volume of fluid, often used in abdominal surgeries. 3. Rayon sponges, non-woven sponges made from rayon fibers used for their high absorbency. 4. Cotton balls, small round sponges used for specific applications where precision is needed. 5. Sponge stick, a long handle with sponge attached used for deeper access in surgical sites. Parts: material typically made up of cotton or synthetic fibers. To size, available in various sizes depending on the type and intended use. Example: 4 into 4 inches, 5 into 9 inches. 3. Thread count, the number of threads per inch, which affects absorbency and durability. 4. Radio opaque marker, some sponges may contain a radio opaque strip to make them visible on X-rays, helping to prevent itching. Sponges post-surgery. Uses: 1. Absorption, to suck up blood and other fluid during surgery. 2. Protection, to protect underlying tissues from mechanical injury. 3. Visibility, to provide a clear view of the surgical field by reducing blood pooling. 4. Packing, to pack cavities or wounds to control bleeding. 5. Dressing, to cover surgical sites after procedures. Precautions: 1. Count and track, always count sponges before and after surgery to prevent retention. Use a sponge counter or system to ensure none are left in the body. 2. Sterility, ensure all sponges are sterile before use to reduce the risk of infection. 3. Labeling, Clearly label different types and sizes of sponges to avoid confusion during surgery. For disposal of used sponges properly to prevent and contamination and infections. How to use? 1. Preparation. Ensure the surgical field in sterile. Open the sponge packaging carefully to avoid contamination. 2. Placement. Place the sponge in the surgical area where absorption is needed. Ensure it is in the appropriate location to avoid movement during the procedure. 3. Absorption. Allow the sponge to absorb fluid during the surgery. Monitor the sponge for saturation. It may need to be changed or replaced as it becomes soaked. 4. Count. Keep a running total of sponges used. Document the count in the surgical notes. 5. Post procedure check. After the procedure, recount all sponges to ensure none are left inside the patient. Use imaging if necessary to confirm the absence of retained sponges. Thank you. Have a nice day.